Hello everyone and welcome to my video. My name is Kenny and I'm a first year MBBS student from the University of Cyberjaya. In this video, I will be talking about Entacapone, or also known as Comtan, which is its drug name. So basically, Entacapone is a medication that is used in the treatment of Parkinson's disease. However, entacapone needs to be used with other drugs such as levodopa or a levodopa-carbidopa mix. In other words, entacapone on its own does not actually has any effect on the treatment of Parkinson's disease. In order to understand why entacapone plays a big role when taken with other drugs such as levodopa, but is useless when taken alone, we must understand the mechanism of action of this drug. But first and foremost, we must understand Parkinson's disease. For Parkinson's disease, there are still a lot of aspects of the disease that we do not fully understand. However, Parkinson's symptoms are believed to be derived from damage to the substantia nigra in the basal ganglia, which is a section of the midbrain which plays a part in regulating voluntary movement. As such, it has direct connection with the motor cortex and influence on express movement. The dopamine produced by the substantia nigra plays a very important role. Dopamine function to smoothens one of the function of the basal ganglia system, which is preventing movement. Dopamine works by binding both the D1 and D2 receptors. When dopamine binds to D2 receptors on the GABAergic neurons, it inhibits these neurons from releasing inhibiting GABA, thus preventing the complete blockage of movement. When dopamine binds to D1 receptors, it functions to allow movement further stimulated by the motor cortex, which allows movement to be more regularly occurred. In both instances, dopamine prevents the basal ganglion from stopping all movement, thus making our movements more natural and smooth instead of rigid and robotic. So, such as in Parkinson's disease, when there is damage to the substantia nigra, there is not enough dopamine release to help keep our movements smooth, resulting in rigidity, tremors, akinesia, and postural instability, which are the known symptoms of the Parkinson's disease. Therefore, the goal to treating Parkinson's disease is generally to increase the dopamine levels in the brain. But dopamine cannot be used by itself due to the blood-brain barrier, which prevents the dopamine from entering the brain tissue. Instead, levodopa is used. Levodopa is a precursor to dopamine that can cross the blood-brain barrier. In the brain, remaining neurons from the substantia nigra and the other regions decarboxylate levodopa to form larger dopamine stores, thus increasing dopamine presence in the basal ganglia system, which can reduce some of the Parkinson's symptoms. Unfortunately, levodopa on its own has a very small bioavailability, with only 2% of the drug reaching the brain. This is because of the breakdown of the levodopa can occur both in the peripheral and central nervous system. In the periphery, the levodopa can be decarboxylated into dopamine, preventing it from crossing the blood-brain barrier. It can also be broken down by COMT, which is an enzyme that breaks down levodopa, thus limiting the amount delivered to the brain. The metabolism of levodopa may result in a rapid reduction of the drug to below therapeutic levels. Now that we have a certain understanding of Parkinson's disease and levodopa, it will be easier for us to understand the importance and function of entacapone. So, we know that levodopa has a very small bioavailability, which is only 2%. In order to compensate for this, entacapone is especially used for this reason. Entacapone acts as a COMT inhibitor. By blocking COMT, entacapone prevents levodopa breakdown in the peripheral nervous system, thus increasing levodopa bioavailability to the central nervous system. Entacapone has been shown to reduce reoccurrence of the symptoms of Parkinson's disease throughout the patient's day, and also to allow for lower dosage of levodopa required by the patient. So, as a conclusion, entacapone allows for greater therapeutic control of levodopa and therefore Parkinson's symptoms. Now, to get into the specifics of the drug. Entacapone can be taken in orally with levodopa up to 8 times daily. The individual dose is usually 200 milligrams. The following would be some of the side effects the patients may experience when taking entacapone. If the patient starts to develop these serious side effects, they are advised to immediately consult their doctors. When taking entacapone, the patient's Parkinson's symptoms will be monitored as the goal of entacapone is to reduce fluctuations of these symptoms. The other medication taken by the patients will also be monitored. This is because entacapone can prevent the metabolism of drugs such as methyldopa and dobutamine. And last but not least, according to the FDA, entacapone is in the pregnancy category C, which means teratogenic effects have been found in the animal studies. Entacapone should only be used in pregnancy if the benefit outweighs the risk. Thank you for watching. And if you enjoyed the video, please leave a like and comment and smash that subscribe button. See you guys next time. Thank you.